Hi, my name is Amy Macdonald. I'm a psychiatric mental health nurse practitioner.
I'm Amber Wagner, and I'm a licensed clinical social worker.
And I'm Dr. Mary Anderson, a psychiatrist, and we're here today to talk about mental health.
What drives it?
How to understand it.
And what you can do about it. Mental health exists on a spectrum, and most of us move up and down it over time.
We are managing aging parents, raising children, working full-time jobs. There's various things going on in our environments, our community, our larger global community.
It's really about the intersection of your own biology and your lived experience.
We have, over 100 different neurotransmitters in our brain, kind of controlling how we feel. We have serotonin, I'm sure you've heard of, which impacts our mood. We have dopamine, which is kind of like our pleasure seeker. We have oxytocin, which kind of helps calm us down. And depending on, how elevated our stress level is or how long we've been under stress, those neurotransmitters can be impacted, and that will impact how we feel.
Stress activates cortisol, our main stress hormone. Cortisol is helpful in short bursts, but when stress is chronic and cortisol stays elevated, it can interfere with serotonin, disrupt sleep, increase anxiety, and make emotional recovery harder.
Research really indicates that people who report social isolation and loneliness at higher levels are also at higher risk for stroke, heart disease, and dementia.
Real contact, people making connections is important, and it's inherent in who we are. Our ancestors had to belong to a group or a family to survive. So by genuine connection with people, we reinforce that sense of safety, that we are not alone.
I like to use a little acronym with my patients. I call it the NEST. So imagine you're a baby bird in a nest and you want somebody to take care of you, right? Like a mama bird or a papa bird. So the acronym is N for nutrition. So really decreasing sugary processed foods, trying to eat a lot of fruits and vegetables. The E is for exercise. So making sure that we're getting daily movement, daily activity. S is for sleep. So making sure that we're getting 7 to 9 hours a night. And if we're not getting that much sleep, really exploring why we're not getting that much sleep and talking with somebody about that. And the last one is T for thoughts. This is one that I don't think we think a lot about with our mental health, but whether we pray or we meditate, or it could even be journaling, really just writing out those feelings and those thoughts that are really bothering us.
Listen to your body. That's a signal. That's a sign that maybe you're dealing with some depression. Even if it's situational depression and it's not chronic, it's okay to ask for help. But there are certain common themes. So things like disrupted sleep patterns. Maybe you're sleeping more, maybe you're sleeping less. Disrupted eating patterns, same thing. That's not really you and it's not your typical pattern. Or maybe you're experiencing a low mood or not interested in activities or feeling down or feeling like just displeasure a lot of the time. Those can be signals that something different might be happening for you.
If you feel like you need help or want to reach out to somebody, there are many doors into care. It could be your primary care physician, a behavioral health provider, OBGYN, specialist, any provider, and a crisis line such as 988.
Mental health is a very individual experience. What works for one person may not work for another. So you really need to think about mental health treatment as not a quick fix, but a journey and a process.
Therapy can help with skills and perspective, keep reinforcing the things that are helpful, and also to address if there are negative messages going on inside your head.
The important thing is to think of it as a toolbox. So you would really work with your clinician or your provider to figure out what tools can you put in your toolbox that will work for you.